Hello everyone, this is Dr. Michael Shearer with Learn Locator, a free resource on how to treatment plan, utilize, and maintain Locator and Locator RTX attachments for overdentures. This YouTube video is aimed at describing the new and really cool denture removal tool. This denture removal tool is something that I know I've been asking for a long time, and other clinicians have been coming up to me and asking me, Dr. Shearer, how do you get patients to remove their really retentive overdentures? Well, now we've got a solution for that. The denture removal tool is perfectly suited to allow a patient to easily grasp and remove an upper or a lower overdenture. So case in point, a lot of patients in my practice are wearing this, either 2 or 4 implant overdentures on the mandible, or potentially 4 to 6 implants on the maxillary arch, and I know sometimes it can get incredibly retentive and difficult to remove, especially for my older patients or those potentially with osteoarthritis that have limited dexterity with their fingers to be able to either push from here or to pull from here. And the tricky part is that we sit here and we show a patient this, or we easily pull from this back corner back in here. But remember, our patients aren't used to working with teeth. They may be new to dentures, or heck, it might be a patient that's been wearing a denture for so long that's used to this really loose, sloppy denture. You give them a Locator overdenture or a Locator RTX overdenture or even a Saturno overdenture, you take something that's really loose and it's incredibly difficult to remove. What happens there is that even this point, if I even start a patient out with a light blue insert, they're coming back to me and they say, gosh, could I go a little bit stronger? I change out the blue inserts and I put in something like a pink or even a clear Locator insert. Yes, it's incredibly retentive, but some of my patients just can't make that force where they push up with their hands. So I have to reel back and go to the light blue inserts, and the patient says, oh, but Dr. Shearer, I'd love it if I had something that just allowed me to tug on it. And enter the denture removal tool. When Zest came to me and said, hey, we're thinking about releasing this tool, I said, oh my gosh, I want one. I can tell you I've got so many patients that are begging for this little instrument. And this is just so easily used. The key is I've been using it in my practice for some time now. I find it so easy to instruct patients. It's also easy for them to be able to utilize with one hand. So that way I can easily teach them how to go ahead and push up to allow their overdenture to be removed. Or even sometimes what I do is to teach them how to remove from a section, just to pull from this back corner, just like that in here. What I find though is most patients prefer to kind of push up from these corners down in here and down over in here. And sometimes it can be really hard to push if I push really hard. But what happens is that yes, with enough dexterity you should be able to remove your overdenture by doing so. But there are some patients maybe with osteoarthritis where they come in here and they go, oh gosh, or heck, a caregiver who says, I would love to be able to take out my mother, my grandmother's denture for them to help them be able to clean it, but I don't know about putting my hands into her mouth or to his mouth. This tool allows our osteoarthritic patients, our older patients, or heck, our everyday patients to easily take this and to allow the removal of the denture. Or on the maxillary arch, allows the denture to come up from this upper corner and to pull straight down, just like so. It's really nice, really beautiful, very attractive, and also create these little notch patterns in here so you can grip it nice and easily. Or I can always add a little bit of some autopolymerizing acrylic resin or light cured acrylic resin if I need to bulk this out to make it a little bit bigger for my really osteoarthritic patients. This tool is just really fantastic, something I've been asking for some time. As a clinician, what I've been doing is I've just been giving this to my patients. It's a part of the value-added service of going with an implant overdenture because it just really makes our job so much easier if the patient doesn't come in all the time for sore spots because I have to use a light insert, or somebody who comes in with just kind of a messy Locator abutment or RTX or Saturno abutments, and they tell me, well, it's just because I leave my teeth in all the time. I really need to concentrate on removing this. I don't have a chance to be able to clean it as often as I'd like to, doctor. This tool is something that I have just given every patient. And Zest makes it really easy because it comes in a pack of 10, very simple, something that allows us to go ahead and easily just say, okay, Here you go. This is a little tool. It goes into our denture bag along with the little box that the patient keep it in, maybe a tablet, a fizzy tablet, etc., etc. So while I've described our denture removal tool here on the benchtop, sometimes I find it most effective if I just go ahead and I turn it over to my patient, Jan. Jan is just a wonderful patient of mine. She's been so happy with her 4-implant overdenture. She'd like to go ahead and describe to you all exactly how she uses the tool. Take it away, Jan.
I wasn't able to remove it if it was any stronger than what we started out with, which you call the kindergarten clips. And then now I'm able to remove it easily with the stronger clips. And with the kindergarten clips in, then they got weak very quickly to where we were having to change them all the time. They didn't hold in on some foods that I would eat. They'd kind of pop loose and the food would get underneath. Where I think with these stronger clips, it's going to stay in better. And with the tool, I'm able to remove it where I have trouble removing it with just my fingers. The curvature this way is fantastic because you can either put it in any direction you want to put it, and it's a thumb rest.
Awesome.
For adding more pressure. But you don't need a whole lot of pressure when you're using it. I like bright colors. And I think that if you have a bright color, you don't lose it as easy.
If you look at the sides of it here, it's got a rounded corner to it. Plus it also, not in your case, but in some other patients where we do this on the upper, it also has an upper and lower setting feature. So you can seat the denture and pull it down. All right, snap it on in. Okay, now try pushing from that front spot. Perfect. And now push it in from the back. You started to develop some really bad arthritis, which you said that you're starting to have some limited ability to push with your thumb. And that's kind of somewhat of a scary thing with having a denture that's so tight. Would a tool like this be able to help you as a patient?
Yes. I don't think I'd be able to remove them at all without some sort of tool because I don't have any strength in my thumbs. And I can't do it with my fingers at all. I think it will allow me to have a lot stronger hold on my teeth to where I might be able to eat everything instead of just a few things. And the thing I like with it is it will fit in most toothbrush holders, right along with the toothbrushes. I'm glad that they've developed something like this that will help people like me. It isn't unattractive, and it does the job that it was designed to do. And so I am very pleased with the design of it.
Perfect.